sure that we understand what the future of medicine looks like. And it won't be how we thought about it in the past, but how do we think about how we even further advance not just the science, but how we interpret the science through big data sets to be able to more appropriately develop treatment plans and watch the improvement of health outcomes from our ability to interpret data in a way that we never have before. That's an exciting moment.
The ability to now advance care at a pace that was unthinkable even at Johns Hopkins a month or two ago is now here with us today.
inHealth has been a game changer for Johns Hopkins, making health data available to the broader community and really bringing all of these diverse interdisciplinary expertise together with much greater power than we had, even a few years ago.
Now through inHealth, the scale at which we can access data and use data science and AI analytic tools to learn from that data and really carry out research advances is unparalleled. A recent example is how we've taken the whole set of patient record data that we have and de-identified it, meaning removed all the identifiers that can link it to individual patients so that we can keep patient security and safety at the top of our minds.
In practical terms, enterprise data infrastructure really means providing a platform and tooling to allow our researchers to spend more time on the science and a lot less time on gathering the data.
Patient Insight was made to summarize data. It's a dashboard. Clinicians can use it to speed up their chart review. They don't have to hunt all over the EHR to find the data that they want. It's not split up in tabular format here and there. They see it in context. All the metrics are lined up in context. Think of it as bringing out signal from the noise. We've got a lot of data. It's there if you want to hunt for it, but there's not that much time to extract it. The technology is there just to bring that information forward so the clinician can make their own analyses based on that important data.
It's one of the rare opportunities where our clinical and research mission are aligned, because it brings those clinical insights back into the research space where we could utilize our clinical data, operationalize it, take better care of our patients, and then bring those insights back into our clinical care paradigms.
The Health General Reasoner is a tool based on a large language model where it takes in input from the patient's chart records as well as lab values, and is able to categorize different risk factors that are currently in place that we know are associated with occurrences of VT in the hospital.
The tool is extremely accurate at predicting who's at risk for VTE.
It really does help clinicians in decision making, helps us with our efficiency, and ultimately to help better understand and not miss any parts about the patients that we're taking care of.
The power of inHealth is the data, the clinical insight, and the power of data science to help each of those things work together in fundamentally different ways. At the DSAI initiative, partnering with inHealth is the exact set of tools we now need to advance this in ways that we even couldn't do 5 years ago.
Data is foundational to building high-quality AI models. It's sort of garbage in, garbage out, or high-quality data in, high-quality models out. And so the broader and more high-quality data that we can make available related to human health and clinical practice, the better our ability to model the disease processes, the clinical processes, et cetera, that come together to allow us to identify the patterns that are relevant to many, many different aspects in medicine that could be driven by AI models, including diagnosis, treatment, trajectory tracking, and more.
We can do this at a place like ours where we can bring to bear the incredible strengths of our research university, the full breadth and caliber of that, alongside the incredible strengths of our health system, one of the best in the world at taking care of patients and really making sure we're doing innovative care delivery at the outset, and really have that cycle continue in ways that can be really profound for human health.
But the future of medicine has always been in the research, but even more so with technology changing as rapidly as it is, if we can enable institutions like Johns Hopkins Medicine to create the next wave of technology, that's going to be really exciting. So yeah, it's a wonderful time to be in tech, and it's a wonderful time to be in tech at Hopkins.
I think we sit on the edge of a moment in the history of the overall Johns Hopkins enterprise that brings us all together, all schools, the health system, and making sure that we take that data and make it relatable to the human being. And that's something that will never be replaced by AI. is that human-to-human interaction that brings the art and the heart of what we do together.